we've used the weekly carboplatin paclitaxel with consolidation carboplatin paclitaxel for 2 cycles as a standard. We've also used cisplatin etoposide, given either a couple different regimens, but usually on this day 1 through 5 and then day 8 complex regimen, but 2 cycles of that, full doses during the radiation and then without consolidation. And then some have used the Pacific, from the Pacific they use those. There's also a cisplatin or carboplatin and Pemetrexed that is often used. There's a little bit less data there, one large trial that wasn't necessarily showing equivalency, but often interpreted that way, but that had a lot of consolidation chemo. So we're left with more questions now that Pacific has come up. On Pacific, patients who had had any of those chemotherapy backbones along with radiation were able to be enrolled. On Pacific, patients did not get additional chemo after the concurrent chemotherapy and radiation. So if someone was getting cisplatin etoposide, we know that anything else has never been shown to be helpful. So 2 cycles cisplatin etoposide with radiation, often on that EP 50-50 regimen, that's great. And then we just add durvalumab, and I think everyone's very comfortable that we've done a very full, complete regimen that way. When we're doing weekly carboplatin paclitaxel, as was done in this case, there's still a lot of questions about what do we do about that extra carboplatin paclitaxel that's normally given at full doses as 2 cycles for consolidation. We've never had data telling us that we don't have to do that when we give the weekly carboplatin paclitaxel, so there's a little bit of discomfort. On Pacific, the patients getting weekly carboplatin paclitaxel did not get additional chemo. They stopped, and then they went on and got their durvalumab. And when one looks at the data from Pacific overall, there have been questions raised. One of the biggest criticisms is the fact that the progression-free survival on the control arm, on the chemo alone, was not as good as we would have expected. And it's true that that point of progression-free survival is counted from the completion of the chemoradiation. Chemoradiation takes a couple months, so if we add on to that, it was about 5.6 months, you add another couple months onto that, you're still not quite in the PFS range that we've seen historically with concurrent chemoradiation alone. And so there's some question that maybe by having so many patients getting weekly carboplatin paclitaxel and not getting any additional chemo, that they were a little bit undertreated. So I think that's one thing to just bring up. We don't have answers to it yet. I think for a patient who is not able to get cisplatin etoposide, gets weekly carboplatin paclitaxel like this patient, and then is going to go on to get durvalumab, it is important to start early like he did. So this patient had healed up after getting his chemoradiation, was doing okay, and they tried to get in and start treatment. And really, the goal is to start the durvalumab as soon as possible, because we know from Pacific, initially they actually were trying to get everybody started within a fairly short time period, within, I don't remember exactly, but I think it was like 3-4 weeks. And they realized that logistically that was pretty tough, so they expanded it out. But there are some subsets saying that those who started sooner seem to do a little bit better, and there's this whole idea that if you're getting the chemoradiation, that's when there's the most antigen release. Theoretically, that's going to be the best time for the durvalumab to have its strongest impact. So you want to start soon. And whether or not to add in the chemo and then delay that has been the question. It was not done on Pacific. So the standard approach from Pacific is give your chemoradiation, start durvalumab as soon as you can, continue it for a year. That's where the benefit was seen. But I think we need to still address, if someone's had weekly carboplatin paclitaxel, do we try to give 1 cycle of chemo before we start the durvalumab or not? And that's still unaddressed.